Hi, my name is Jordan Dunehofer. Today's date is 1/18/18. The time is approximately 12:35 in the afternoon. Today I will be inserting a Foley catheter on a female patient. So first, upon walking into my patient's room and verifying my physician's orders, I would perform hand hygiene, provide patient privacy, and introduce myself to the patient. I would identify the patient with 2 patient identifiers, and then I would explain what procedure was about to happen and begin assessing them. So first I would assess them for their ability to understand the procedure, the characteristics of their last void, which would be the color, the amount, and the odor of their void, their ability to get into the position that is required for the procedure, and any allergies my patient might have, but especially to betadine and latex. So after that was done, I would raise my patient to a comfortable working height. And assist my patient if they require my assistance to get into the appropriate position for the procedure, which would be a frog-like stance. I would then don my non-sterile gloves. And begin by performing pericare on my patient. So first, with a wet washcloth, I would wipe from front to back. And again, from front to back. And then on the other side, I would wipe from front to back. Once that is done, I would discard my supplies. Get my Foley tray and begin my procedure. So first I would open my Foley kit, away from me first. I would take my sterile drape, and with the shiny side down, I would place that under my patient. I would take out my sterile gloves and don them. I would then set up my procedure, lubricate my Foley tip about 2 to 3 inches, and attach the syringe filled with sterile water to my Foley. After that, I would take out my sterile swabs, and with my non-dominant hand, I would spread the labia and begin from front to back, on the side from front to back, and again from front to back. I would then take my Foley kit, my lubricated tip, insert my Foley, until I see urine return. I would insert another inch or so, inflate the balloon on the catheter and then pull back until I met resistance. Once that is done, I would take my Foley and I would attach it to a clean part on the patient's leg, return my patient to a comfortable position, and keeping the bag lower than the level of the bladder, I would attach it to a non-movable part on the patient's bed, making sure the tubing is not kinked. I would remove my supplies, remove my gloves, cover the patient up, lower the patient to a safe height, making sure their call light is in reach. I would ask them if they needed anything, and if they didn't need anything else, I would leave the room and go document my procedure. Thank you.